Chest binding has been around for hundreds of years, but if done improperly, it could pose some health hazards. Occupational therapist Janine Stoner is on a mission to educate patients. Why did you start the binding program at Middlesex Health?
So we were finding that people were binding, that they were finding ways to bind through their friends or the internet or trial and error. And what was happening was they were coming up with some injuries, whether it was some nerve compression injuries and muscle weakness or muscle irritation and skin irritation and things that were harmful and uncomfortable. And so we wanted to find a safe and effective way to bind.
So you have binding garments behind you. How do they work exactly?
So these are commercially made, and they're specifically made so to avoid injury. But more importantly is that they're sized appropriately. So part of the program was really to ensure that people were getting the right size, and that things like the armhole were big enough, that you are compressing what you want to, but not compressing things that you don't want to. So we want to allow room for a chest expansion during the breathing process, but we don't want to cause any injury. So these are commercially available. They come in different sizes, different lengths, different texture. Some of them have an inside band that is compressive with a softer shell, and other ones are without that.
What are some of the things that people are doing that are the wrong way?
When people are first starting out and they're just trial and error, people have used ACE bandages, which is essentially putting a tourniquet right around your whole chest, and that's very dangerous for many reasons, and we don't want anybody to do that. There's people that have used duct tape and tried to just flatten things out using duct tape, but the glue on duct tape is very dangerous and it's a skin irritant, and as you pull it off, it's very strong, and you could actually separate the layers of the epidermis. So we do not want anybody doing that, and we want to provide a safe way for them to do it.
Tell me a little bit about the proactive approach that you've taken over there at Middlesex Health. What actually happens in a session when somebody comes in?
So they're referred from their doctors, and they come for occupational therapy. And one of the things that we do is I take 3 different measurements, and we use a sizing chart. We make sure that they have the right size. Then we have a variety of different styles that they can try to make sure that it fits properly. Once we find the right garment, what is the most comfortable for you, has the desired effect, is safe, then we talk about how do you maintain your respiration. So we do some breathing exercises, because if you are compressing your chest, you are going to have shallow breathing, and it's going to be difficult to take a deep breath. So we want people to practice that. And so we do breathing exercises. We also do stretches to avoid any muscle fatigue or injury. And we just kind of make sure that people have a way to take care of themselves while they are still expressing themselves as they feel they need to.
And so that's one of the reasons why you're conducting a study, right? So tell me a little bit about what the study entails and what the goal of the study is.
So the study is to determine if there are any pulmonary effects of binding. And Middlesex Health has been really great about looking to have evidence-based treatment and evidence-based approaches to this program, and to making sure that we are doing the proper thing. And so what we're going to have is people who want to sign up, people who are already currently binding, can come, and it's a one-time test where they will be measured. Their pulmonary function is measured through what we call a pulmonary function test. It's conducted by a respiratory therapist. It's analyzed by a pulmonologist, and measures any restrictions that somebody may have in their breathing. That information will be taken, and we will analyze that data. We also will have another measurement that people will take home with them and keep a journal for 1 week. And all of that information will help us to determine what is the best approach to teaching safe binding.
Well, Janine, thank you so much for joining us today.
Thank you very much.
To find out more about the study, call 860-358-6718.